you already know that the different signs are there, right? There is early signs, late signs are very important clinically, right? So what are the early signs? Bolo, Kiki. Anxiety, tachypnea. Very good. Late, Kiki have. No, B for first B for Bradycardia. Very good. Late sign is Bradycardia is very important because it is a dreaded complications, right? Then, check. So B, E, D, and C. Now, if in this examination also, you already know that the different chapters have been done. In the respiratory chapter, I advised that to give from short note and explain why, not in the long questions. Probably we avoid the long questions from the respiratory system. But renal system, nerve physiology, yes, and then cardiovascular system, these are all for your long questions, right? 50 marks question থাকবে, MCQ থাকবে, 10টার মধ্যে বোধহয় MCQ থাকবে, and you have to get at least must 25. It's very important. আগের বার কে কে পাস করেছিস? হাত তোল। 1 2 3 1 2 3 4 চারজন মাত্র। তাহলে বুঝতে পারছিস এই কটা স্টুডেন্টের মধ্যে এই প্রবলেমগুলো হচ্ছে। যদি ওইটা পাও তাহলে দিও। এইটা নিয়ে আমার অসুবিধা হয়, আমার কানে লাগে। যদি দেখো যে ওইটা আছে তাহলে দাও। So it's very important to get 25 marks, otherwise the result তো নিশ্চয়ই পেয়ে গেছিস। সিনিয়র দাদাদের খুব অবস্থা খারাপ। But believe me, যদি তোরা রেগুলার পড়াশোনা করিস তাহলে that will be very much helpful to get easily 25 এবং 30-35 পর্যন্ত হয়ে যেতে পারে, কোনো অসুবিধা নেই। At least in my classes or my subjects, whatever I am delivering, if you go through my classes and the videos, then you will definitely will pass, whatever it may be your questions, right? Suppose in case of in examinations comes that what are the factors that depends that is responsible for diffusion of gases throughout the lungs. ফ্যাক্টরস গুলো বলতে গেলে আমার ফর্মুলা বলে দিয়েছিলাম, রাইট? ফর্মুলা থেকে আমি দেবো বলে কোনো অসুবিধা নেই। নেম সাম ডিজিজ হুইচ কজেস দ্য ডিক্রিজ ডিফিউশন। হ্যাঁ, নেম সাম ডিজিজ হুইচ কজেস দ্য ডিক্রিজ দ্য ডিফিউশন। সেম থিং। তাহলে কোন কোনগুলো হবে শুনি একবার। এমফাইসিমা, প্রাইমারি ফাইব্রোসিস। প্রাইমারি ফাইব্রোসিস কেন হবে? থিকনেস, এখানে একটাই ওয়ার্ড, থিকনেস। হ্যাঁ হ্যাঁ, না ডিস্ট্রেস নয়, আমি সেটা বলছি না। আমি বলছি যে পালমোনারি ফাইব্রোসিস, why the primary fibrosis causing the decreased diffusion? থিকনেস। থিকনেস নিয়ে আমার জিনিসটা হয়ে যাবে। থিকনেস তো ইনভার্সলি প্রপোর্শনাল, হ্যাঁ, থিকনেসটা নিচে ছিল, so that's why it important. Similarly, you can get such questions like that. Pulmonary edema causes the less diffusion. Explain why, right? Simple. কি হবে answer, কি হবে? Against is coming as a thickness. So during this writing, you have to at least show your examiner what is the formula of the volume of ventilation, মানে কতটা যাচ্ছে, রাইট? তার মধ্যে আমি যদি প্রপোর্শন করে লিখি তাহলেও হবে, আর ইকুয়াল টু করে লিখলে আমাকে কি করতে হবে না, আমাকে ডিফিউশন কোএফিশিয়েন্ট লিখতে হবে। তার মধ্যে সলিবিলিটি আছে, তার মধ্যে মলিকুলার ওয়েটটা কোথায় থাকে, মলিকুলার ওয়েটটা রুট ওভার মলিকুলার ওয়েট, বুঝতে পারছিস? এইগুলো থেকে শুধু ওই ফর্মুলাটুকু জানলেই এই ধরনের কোশ্চেন দেওয়া যাবে। Why carbon monoxide is important to detect your diffusion capacity, right? DLCO is very important for your POF. It may come as a explain why the carbon dioxide. It may come as a your long question also saying that you are dealing with a restrictive pulmonary diseases that may be intrinsic as well as extrinsic. Now, how can you detect or how can you confirm that it is a intrinsic or extrinsic? By doing the DLCO, because DLCO will decrease in intrinsic. Simple, right? So in this fashion you have to write. In case of CVS, cardiovascular system, what is the cardiac output? What are the factors influence the cardiac output? What is the exercise induced cardiovascular changes, right? In this fashion you have to go for it. What do you mean by Frank-Starling's law? What do you mean by preload? What are the factors influence the preload and afterload? These are your basic questions you have to read for your exam. For your exam, not only to pass, to get the honors mark, right? Similarly, non-muscle physiology, whatever it may be, from A to Z, you have to read. Renal physiology, you have to read A to Z, right? What is your juxtaglomerular cells? Name some enzymes released from that. What is the role in the RAS? So these things are very important. So this is your overall examination. That is the second time you are giving. So you will get only those are not qualified in the international first international. Be very careful. I will not allow if the 50% marks all over the internal assessment. That will create a problem. That will create a problem to enter to get the first professional MBBS. Strict guidelines are there. NMC guidelines is there. University guidelines are there. So you have to must pass. I am not saying that you have to get you have to get the 40 marks, 42 marks. No, not at all. I am only saying you have to get 24 to 25, not 24 at all. 24 and half hobe na. 25 to 25. So prepare on that case. If you target from now that you have to get the 50% marks to pass in all subjects, you will pass. But if you target the 40% to pass, then you will fail. That's like your seniors. তারা কি ভেবেছিল যে 40% পেলে হয়ে যাবে, 140 পেলে অনেক, কিন্তু টোটালে গিয়ে কি হলো? দ্যাট কজেস দ্য 150 পেতে হবে 300 এ, পাইনি? কারো আছে 116, কারো আছে 115, রিভিউ করেও কিছুতেই পাস করবে না। যাদের 1-2 নম্বর তাদেরকে করিয়ে দেওয়া হবে হয়তো। So this is the very crisis period. You will lose your batchmates, you will lose your friends. So be very very careful. আজকে দেখ একটা ইন্টারনাল অ্যাসেসমেন্টের জন্য, একটা 50 নম্বর পরীক্ষার জন্য স্টুডেন্ট নাম্বার দেখ। সো দ্যাট ইজ ইয়োর ফেট। ইম্পর্টেন্ট টপিক পড়ানো হবে, এই টপিক তো পড়ানো হবে না, ক্লাস তো বন্ধ হয়নি, ঠিক আছে? কোন ডিপার্টমেন্ট ক্লাস বন্ধ করেছে, দ্যাট ইজ ডিফারেন্ট। কিন্তু ইন্টারনাল অ্যাসেসমেন্টের জন্য কোথাও বলা নেই এনএমসি গাইডলাইন বা ইউনিভার্সিটি গাইডলাইন্সে যে ক্লাস বন্ধ করতে হবে। ক্লাস বন্ধ করার কোনো প্রশ্নই ওঠে না। So now we are going into the topic, that is the hypoxia. You already know what is the difference between the hypoxia and hypoxemia, right? So hypoxia, why it is important? Because the early signs are late sign you get. You can came across with such patients in your OPD, right? We always do in the emergency. There's what is the patient has SpO2, that is saturations. That means how much hemoglobin have been oxygen saturated. That's very important. But এটাকে যদি মেনটেন করতে হয়, to maintain this one, we have to maintain this arterial partial pressure of O2. To maintain this, if it to be maintained, then that must to be that's maintenance of this one. তাহলে বুঝতে পারছিস what is the chain? তাহলে partial pressure of oxygen in alveoli, then partial pressure of arterial system of oxygen, and then SpO2 is maintained. So main thing is here, it is here, and this is maintained by atmospheric your barometric pressure, right? And this is maintained by your percent concentration of O2, N2, etc. Right? From Dalton's law, we know the partial pressure means what? Summation of all the gases, the concentration of gases. This means your 760 যে আসছে, not for the oxygen, it's for your carbon dioxide, it's for your nitrogen, etc., etc. and 21% for your oxygen, 78% for your nitrogen, 0.3% is the carbon dioxide, and others gases also very less. So this summation gives you 760. If anything happens to cause this one or this one, then that will be problem. That will be create problem. So whenever we are giving the pulse oximeter, আমরা কোভিডের সময় দেখতাম না সবসময় pulse oximeter কেন দেখতাম? দেখতাম what is happening here, what is happening in the capillary level, what is your SpO2, that is what is your oxygen saturation, and this oxygen saturation is maintained by means your partial pressure of arterial PO2 and then alveoli. So আমরা indirectly আমরা অনেক কিছু information after doing this one পেয়ে যাচ্ছি. Now, if it is less than suppose 90, such saturation most of the cases should be maintained in adult, that is 95%. Not only adults, in children also, we have to more than 95% saturation is important. If it is less than 90, then you have to be careful. If it is 80, 88, 85, then you have to be careful. And we give the key 100% oxygen. Why we are giving the 100% oxygen? Because 21% oxygen is in air normally, and we are giving 100% oxygen. That must be increase some of partial pressure of alveoli. That will increase. But in case of shunting, there is no helpful at all. I am coming how it is not helpful. So by keeping mind in all these things, hypoxia is divided into 4 types. What are those? Hypoxic hypoxia, stagnant or ischemic hypoxia, anemic hypoxia, and histotoxic hypoxia. Very good. So first of all, very important, that is your hypoxic hypoxia. And hypoxic hypoxia, it's literally mean hypoxemia. If you think properly, then you will see that hypoxic hypoxemia is another name, must be hypoxemia. So if any questions come as a hypoxemia, you have to keep in mind that is a telling it is going in favor of hypoxic hypoxia, right? Now hypoxic hypoxia causes are there. Mainly basically 3 different important causes are there. If you forget everything, only think that triangle means causes of. যখনই কোনো জিনিস মনে হবে যে আমি ভুলে যাচ্ছি বা ভুলে যাব, তখন একটা ট্রায়াঙ্গেল করে অ্যাটলিস্ট 3টে পয়েন্ট মনে রাখবি। ফর এক্সাম্পল, এগুলো হচ্ছে ট্যাকটিস টু পাস, রাইট? যখনই তো ট্রায়াঙ্গেল মনে হবে না, তখন মনে হবে ট্রায়াঙ্গেলের উপরে আমি কি লিখেছিলাম, এখানে কি লিখেছিলাম, এখানে দ্যাট শুড বি kept in your memory. So like that, causes are different. Hypoxic hypoxia causes are huge causes, but basic causes from where we can conclude the different causes also. One is your V by Q coupling alternation, right? Etar amar alternation, right? Number 1. Number 2, high altitude. আমি এটা কি এটা বলছি কজ না hypoxic hypoxia, right? So high altitude. And third one is a different pulmonary disease. এইবারেতে দেখ তোরাই বলতে পারবি যে এটা কিভাবে হচ্ছে. So this problem is that from the first, the peak of the triangle, that is the V by Q coupling problem. That means mismatch. And we already know that ventilation perfusion means 3 stage. What does it mean? That is your alveoli. And this is your pulmonary capillary. Simple. So what is happening here? This is your ventilation, right? Here it is your diffusion, and here this is your perfusion. Kono confusion? Nahi. So ventilation, diffusion and perfusion problem hole V by coupling a problem here. So any diseases which causing the ventilation problem, ebar bolo, ventilation problem kore kichu disease er naam bolo নিজেরা ভেবে বলো। অ্যাজমা, ওই যে বলেছো, ঠিক বলেছো। এই যে জাম্প করে যাচ্ছিস মানে ফাইব্রোসিস কোথায় হবে? লাং প্যারেনকাইমা মাথায় হবে। আমি যখন ভেন্টিলেশনের কথা বলছি তখন আমি এয়ারওয়েজ কথা ভাববো। Whenever we are dealing with ventilation, that means we are thinking about airways problem. So airway obstruction, COPD, that means you can say basically not emphysema, you can say the chronic bronchitis. That is a mucus formation. Excessive mucus formation in case of chronic bronchitis. Or asthma, not asthma, basically severe exacerbation of asthma. In that case, asthma amaro ache. Tate ki amar ventilation problem hoche? No. When you are exacerbations or exaggerated, or you can say the status asthmaticus. Status asthmaticus means attack. Severely constricted bronchus. Severely constricted bronchus. এখানটা পুরো চেপে গেছে, মনে করো এখান থেকে আসছে bronchusগুলো, এখান থেকে obstruction হয়ে গেছে। Then again ventilation. Now you have to think about the control of ventilation. কে করছিল control? Neural system, DRG, VRG. They are connected to your intercostal muscles and your phrenic nerve, right? So if any neuromuscular junction problem disease, if any problem of your medulla itself, respiratory drive will be problem. বুঝতে পারছিস কিভাবে জিনিসটা হচ্ছে? So what is happening here? Happening that the ventilation problem is going on. If it is problem in motor neurons, that also fatigue, neuromuscular junction problem, that means what? Myasthenia gravis. নামগুলো বুঝতে পারছিস এবারে? So in this pattern, you have to go for your subject, into the subject. Physiology থেকে তো এবার আর কয় মাস পড়তে বেরিয়ে যাবি। Then that will be clinical applications. যখন applications গুলো আসবে respiratory disease related, এইগুলো যদি তোদের মানে কি বলবো রক্তের মধ্যে থাকে, that will be very easy to remember everything. You can do the diagnosis করলেই ট্রিটমেন্ট খুব সহজ। ট্রিটমেন্ট ফর্মুলাতে আমরা পড়ে নেবো, আমরা জেনে যাবো। প্রবলেম ইজ দ্য ডায়াগনোসিস, অ্যান্ড বিফোর ডায়াগনোসিস ইউ হ্যাভ টু আন্ডারস্ট্যান্ড দ্য নর্মাল ফিজিওলজি অ্যান্ড প্যাথোলজি। সো দিস ইজ ইউর ফিজিওলজি। সো VYQ কাপলিং এর মধ্যে আমার আসছে ভেন্টিলেশন, ডিফিউশন অ্যান্ড পারফিউশন। ভেন্টিলেশনের মধ্যে আমি এআরএস প্রবলেম বললাম, নিউরোমাস্কুলার প্রবলেম বললাম। নিউরোমাস্কুলার মধ্যে প্রবলেমের মধ্যে different diseases are there. There is a myasthenia gravis, motor neuron disease. These things will be problematic for your ventilation. Ventilation problem হয়ে যাবে। কারণ if the contraction of diaphragm does not happen, then that will not increase the volume of your lungs. If increase of the volume of the lung does not happen, then pressure change will not be happen. If pressure does not happen, changes, then your entry of the oxygen does not happen. So ventilation problem, right? Similarly, that is a diffusion. Diffusion means ওই সেই formula. Diffusion এলেই আমার সেই formula. কি ছিল? Solubility, pressure changes, area, and also your solubility, and the inversely proportional to thickness and molecular weight, root of molecular weight, right? So এইখানে যা ডিজিজ বলে যাবে বা সব করে কোনো অসুবিধা নেই। এখানে পালমোনারি ফাইব্রোসিস বলবি, নিউমোনিয়া বলবি। হোয়াই নিউমোনিয়া? বিকজ ডিউরিং নিউমোনিয়া exudation, inflammatory exudate from inside your alveoli. তাহলে alveoli যদি আমার এখানে exudation হয়ে যায়, তাহলে আমার থিকনেস ইনক্রিজ করবে। তাহলে এখানে যেটুকু অক্সিজেন এলো ঠিকই, বাট সেটা পাস করতে তার প্রবলেম হবে। দ্যাট ক্রিয়েট প্রবলেম। তো ট্রিটমেন্ট কি? না আমি অ্যান্টিবায়োটিক্স দেবো যদি আমার ব্যাকটেরিয়াল হয়। ভাইরাল হলে ওয়েট করবো, যেমন কোভিডের জন্য। দ্যাট উইল বি ওয়েট, কোনো ট্রিটমেন্ট নেই। হোয়াট ইজ হ্যাপেনিং ইন কেস অফ কোভিড? এই যে VQ মিসম্যাচ হচ্ছিল বলেই that's creating a problem of partial pressure of oxygen in the arterial blood, and ultimately it causing the tissue hypoxia and death. So this is happening that ultimate aim কি আমার? ultimate aim হচ্ছে আমার যাতে এই যে PO2 PO2 যাতে মেনটেন হয়, সিম্পল। সেটাকে মেনটেন করতে গেলে আমাকে এই পাথগুলো পেরিয়ে আসতে হবে, আদারওয়াইজ দ্যাট উইল বি নট পসিবল। সো হোয়াট এভার ইট your diffusion problem, so diffusion problem এর মধ্যে ডিজিজগুলো পালমোনারি ফাইব্রোসিস, পালমোনারি edema, তারপরে তোর ইউ ক্যান সে দ্য নিউমোনিয়া, আর কি বল, emphysema. Yes, emphysema. Definitely it will happen because emphysema তে কি হয়? What happens in emphysema? What do you mean by emphysema? Stand up. What do you mean by emphysema? In which diseases this is an important part? Where are you? Are you in a medical school or in a primary school? এমফাইসিমা কে কে জানিস না হাত তোল। এমফাইসিমা সম্পর্কে কে কে কিচ্ছু জানিস না হাত তোল। সবাই জানিস? পরের জন বলো। হ্যাঁ ঠিক, তাও ঠিক। In which disease it is collaborating? There is a common disease name. পরের জন। No, not I am asking that the which disease component is your emphysema? Is emphysema. One important component is emphysema, another important component is chronic bronchitis. The common disease is what? দুটোকে মিশিয়ে একটা ডিজিজ বলা হয়, সেটা কি? সিওপিডি। তাহলে chronic obstructive pulmonary disease। এই যদি প্রিপারেশনে হাল হয়, এই যে তিনজন হচ্ছে না, I am saying this is not at all accepted. আর if you think that না বেরিয়ে যাবো ঠিক এইভাবে করে, বেরিয়ে কিছু করতে পারবি না। এক্সিট এক্সাম আছে, রাইট? পড়াশোনা করছিস না কি? কিছু বলবি না, ক্লাস থেকে একদম বের করে দেবো। ইউ হ্যাভ টু সে সামথিং। পড়াশোনা হচ্ছে কি হচ্ছে না? You don't understand Bengali, but you have to deal with the patients of the Bengal, right? So what about your study? I am asking, English also. You're delivering Bengali and English both, right? Bengali, English both. Then what is your problem? Are you studying at all? Huh? Tell me one topic of your respiratory your system. Tell me one topic you know. Anyone? Say something. What is that? Tell me one topic. You said I know this. That may be diffusion, that may be ventilation, that may be perfusion. Anything. That may be your control of respiratory system. That may be mechanics of the breathing. That may be compliance, resistance. Tell me what is the function of hemoglobin? Yeah? Carrying oxygen only. Where they carry the oxygen? In which part of the hemoglobin carry the oxygen? So if you think that is only the percentage you have to come, please don't come. And say me, sir, I will not come. Give me my percentage. I will give you. Okay, if you want to come in my class, then some preparation must be there to understand my classes. So why you are here? You don't know anything. You don't know the hemoglobin where it is attached. What are you doing? কাদেরকে পড়াচ্ছি আমরা? From where you have came? From where you have came? From Bihar. Roll number 6. এই তুমি না 6 রোল নাম্বার নোট করো। 6 করেছো? না আমাকে আজকের ডেটে তুমি দিয়ে রাখো 6 রোল নাম্বার। I will call your parents and I will inform what are you doing here. Then after the MBBS, professional MBBS, he will say that guy, कुछ नहीं पढ़ाते हैं सर। Huh? Are you basically interested to study? This is an interesting class. If you get some interest, then only you will come. Otherwise, no. सही बात है, जहाँ इंटरेस्ट लगा वहाँ जाना है। मुझे अगर पसंद नहीं है, मतलब कुछ बोलने की, मुझे पसंद है इसलिए मैं आते हैं। जिस दिन नहीं होगा उस दिन नहीं आऊँगा, क्योंकि मेरा तो पेशेंट ही मेरा मेन है। मैं तो पेशेंट देख के मेरा चल जाता है। So you have to sit down. So this is your ventilation coupling couple. They are the diffusion causes. Now perfusion causing. কি বলবো? Embolism. হ্যাঁ? ইসিমিয়াটা আমি এখানে বলবো না, খুব বেশি ইসিমিয়া এখানে হয় না। এম্বোলিজম, ক্লট এগুলো বলবো, ঠিক আছে? এম্বোলাস, থ্রোম্বাস, হ্যাঁ, কিসের স্ক্লেরোসিস, হ্যাঁ, ওগুলো পরে, ওগুলো তো অনেক ডিজিজে হয়। That is called pulmonary hypertension. That is also important. But another important perfusion problem will be if our congestive cardiac failure happens. Heart does not pump at all. Because right heart, if fails, then it cannot pump the blood into the pulmonary trunk, right? So that will problem of your perfusion. So hypoxia can happen also heart failure. My point is that If any patients come with respiratory failure or your cardiac failure, both can cause hypoxia. So, the respiratory rate increase does not mean always the respiratory cause. That is not the right way to detect. You have to understand what is it is a respiratory cause or cardiac cause or both. So, that is your part job of your as an intern. So, these things happens that your ventilation, perfusion, coupling problem. So, can happen is এখান থেকে আমার মনে কর হার্ট, হ্যাঁ, এখান থেকে রাইট হার্ট আমাকে দিচ্ছিল, সেখান থেকে যেতে পারবে না, ফেলিওর হবে, কনজেশন হবে, congestive cardiac failure. Ultimately it happens as a liver enlargement. Already I have explained this one, how the back pressure of the blood is come into your কি বলেছিলাম portal system. Ultimately that will enlarge the liver. If any patient having the respiratory distress with liver enlargement, that means you have to think you are dealing with a congestive cardiac failure patient. Congestive cardiac failure patient ke dekhte dewa mane already that had happened as a left ventricular failure, and left ventricular features ki pulmonary edema, right? কিভাবে? Simple. Pulmonary কি করে হবে? তাহলে কি left ventricular failure means what? Pulmonary যে veins আছে সে veins থেকে backflow হবে, কোথা থেকে হবে? এখান থেকে backflow হবে, and the pressure inside this vein, pulmonary capillary will increase, hydrostatic pressure will increase, and that hydrostatic pressure increase means Starling forces will increase. Starling force that draws the water into interstitium space, and then the fluid এখানে accumulation হয়ে যাবে, এইখানে the fluid accumulation হবে কোথায় না interstitial space, right? So in this case that is called pulmonary edema, and pulmonary edema itself is creates your diffusion problem, so it is increasing thickness, right? So in this fashion your VQ coupling problem may alter your hypoxia. Now high altitude is a big concept. High altitude means what? আমি 2000 মিটার বা ফুট চলে যাচ্ছি. In the sea level, barometric pressure is 760, and that is accumulated by all the gases. But do you expect that is a 21% in the high altitude? That is a wrong concept. Remember always, in the high altitude, percentage of gas composition will be same. Percentage of the gas composition will be same. But barometric pressure, total barometric pressure will fall. And so, if suppose that can happen into 380, from the 760 to 380, right? And water vapor pressure is mainly 47 millimeter of H. So that will be decreased, and so the partial pressure of oxygen in sea level আমাদের কত এখন কত এখানে বসে বসে 159 to 160. That 760 21% means you're getting what? You are getting the 160 oxygen, 21%, 78% for your nitrogen. So I don't go into the nitrogen at this level. I'm concerned about your hypoxia, that means PO2. So in high altitude, that means suppose this is your sea level and the percent here, উঠে গেছে. Now the barometric pressure is less, but 21% is fixed. 21% চেঞ্জ হয় না, এটা কিন্তু ভাইবাতে জিজ্ঞেস করা হয়. তাহলে percentage of oxygen is same, pressure, barometric pressure is decreasing, so partial pressure of O2 here is fall, এখানে fall করে যাচ্ছে. তো partial pressure of O2 যদি এখানে fall করে, that means PaO2 fall, that will create a problem, and so that some acclimatization happens. সাপোজ মনে কর গ্যাংটকের যারা লোকজন, তাদের মধ্যে কি আছে, কিছু অ্যাক্লিমেটেশন হয়েছে দীর্ঘদিন ধরে থেকে. অ্যাক্লিমেটেশন মিন্স দুটো পার্টে ভাগ করতে হয়, একটা হচ্ছে ভেন্টিলেশন, একটা হচ্ছে সার্কুলেশন. বোঝা যাচ্ছে? অ্যাক্লিমেটেশন আমি এগুলো সব পরে আবার মানে বলবো, জাস্ট পয়েন্ট আউট করছি যে ডিউ টু দ্য হাইপক্সিয়া. অ্যাক্লিমেটেশন মিন্স হোয়াট না অ্যাডাপ্টেশন. দু একটা অ্যাডাপ্টেশন বলে দিচ্ছি আমি এখন. যেমন মনে করো ভেন্টিলেশন পার্টে আমাকে যদি অ্যাডাপ্টেশন করতে হয়, তার মানে আমাকে ভেন্টিলেশনকে বাড়াতে হবে, রাইট? সাপোজ এবার PA2 মানে ক্যাপিটাল A2 কমেছে, PO2 PaO2 তো কমেছে, কত দূর কমলে আমার ভেন্টিলেশন বাড়াতে পারবে এবং কে বাড়াতে পারবে? আমার পার্সিয়াল প্রেশার অফ O2 ইন দ্য আর্টারিয়াল ব্লাড কত কমলে আমরা ভেন্টিলেশনকে বাড়াতে পারবো বডি? ইয়েস, দ্যাট ইজ a 60 millimeter of Hg, partial pressure of oxygen arterial blood যদি কমে যায়, that will this is the stimulate the no, not at all, peripheral chemoreceptor. Remember, chemical or central, basically central and peripheral chemoreceptor. Already say the term that is either chemical chemoreceptor or the peripheral chemoreceptor. Peripheral এর সঙ্গে chemical এর ব্যাপারে সম্পর্ক নেই. So that is covered as, if it is less than 60, then your peripheral chemoreceptor will be stimulated and then into the NTS etc. করে DRG VRG করে ultimately phrenic nerve stimulation, intercostal muscles contraction, and that causing your ventilation increase. Now ventilation you have increased. That means what? Carbon dioxide is washed out. If carbon dioxide was out, that means your respiratory alkalosis, yes. You know already the cause of respiratory alkalosis in case of severe hyperventilation. Calcium কমে যাবে, plasma protein থেকে reduce করবে, all are explained nicely, right? So these things are not you should be keep in blood. Now that is happening in this way. So this is your part that respiratory alkalosis will start. Now carbon dioxide is your wash out, that means falling. ফল করলে কি হবে? Carbon dioxide is falling, then your H plus ion fall, pH কি রেসপিরেটরি, তাই রাইট? যখনই এটা হবে তখনই আমার বডি বলবে ভাই তুই থাম, এত কার্বন ডাইঅক্সাইড যদি কমিয়ে দিস তাহলে আমার প্রবলেম আছে। সো দ্যাট উইল রিটেন, ট্রাই টু রিটেন। সো কি করবে তখন? ভেন্টিলেশনকে কমিয়ে দেবে, কাট থ্রু দিয়ে ওই যে কে ইনহিবিশন হবে। কার্বন ডাইঅক্সাইড যদি আমার বেশি বেরিয়ে যায় তাহলে কার ইনহিবিশন হবে? কেমিক্যাল কেমোরিসেপ্টরে। তার যদি ইনহিবিশন হয়, ইনহিবিশন কার হবে? ডিআরজির। তারপরে কার হবে? ভিআরজি। দুটো মিলে ইনহিবিশন আসছে। ফ্রেনিক নার্ভের ইনহিবিশন হলে কি হবে? কন্ট্রাকশন হবে না। সো দ্যাট উইল নট হ্যাপেন হিয়ার। So there is no contraction at all. So ventilation problem will be there. So if ventilation problem is there, তার মানে কি? What is happening here? For the short period of time, that may be helpful, but not the long term. In case of long term, that will create problem. And the যেই problem হবে, that will come as a kidney. Now the function will come as a kidney to modify the bicarbonate by secreting the more bicarbonate in urine. বোঝা যাচ্ছে? In this way, pH can be maintained by during the high altitude. So we already your different Sherpas advised to ascend very slowly, right? And this phase happens basically in the 12 hours. তাহলে 12 ঘন্টা ধরে এই ঘটনা ঘটতে পারে। So ascend slowly, or if any problem you have to descend. So to that acclimatization, so this is a ventilation part, number 1. Number 2, there is a circulation part. কি হবে? Probably you know about the term that hypoxia causes the induction or formation of hypoxia inducible factor alpha 1. শোনা গেছে? পড়ানো হয়েছে? HIF, আমি তো হেমাটোলজি পড়াইনি। Hypoxia inducible factor 1 alpha. That is a transcription factor. That is transcription factor, and that forms into your renal tubules, right? In this perirenal tubules, this is a important part of hypoxia. যখনই হবে, when there is a hypoxia, this hypoxia inducible factor alpha 1 will increase. Why should this increase? Because this will create the formation of erythropoietin. এমন করে তাকাচ্ছিস, পড়ানো হয়নি তো? খাতা দেখবি। So this is very important part. This is very for this discovery Nobel Prize is there. Hypoxia inducible factor 1 alpha discovery করার জন্য Nobel Prize পাওয়া হয়েছে। এটা কিছুই না, এটা হচ্ছে হাইপক্সিয়ার জন্য the most important stimulus for erythropoiesis কি? Hypoxia. So hypoxia, why it is happening? It is happening because of the transcription factor increase. It is genetically determined. Right? So in case of in Gangtok people, etc., these people having some much more genetic determinant of this in hypoxia inducible factor 1 alpha. 1 alpha didn't means 2 alpha is there or everything is there. I'm not going details at all. It's a huge thing. It will take basically half an hour to take the full classes how it's happening. And this hypoxia inducible factor ultimately is causing the release of erythropoietin by the genetic way. অনেক কিছু ব্যাপার আছে এখানে কিভাবে erythropoietin কে stimulate করা হয়. There is a different sub units are there. I'm not going details at all. So 1 alpha it helps to increase the erythropoietin, and you know that erythropoietin causes the increase of RBC. That means you are the polycythemia. But problem is that polycythemia causes the viscosity because resistance is proportional to the viscosity. If you know the formula again, right? So this creates a problem of your blood viscosity in the problem. But in case of Gangtok people or any high altitude people, that does not happen so frequently because it is balanced. How much oxygen? Why polycythemia is important here? To increase the hemoglobin. Hemoglobin carries the oxygen. এই যে ওই স্টুডেন্টটা বলতে পারলো না। So hemoglobin carries your for you. Hemoglobin carries the oxygen where? Not only oxygen, it carries also the carbon dioxide. And where your oxygen pockets are there? There are 4 pockets of hemoglobin are there to combine your oxygen. That is a cooperative manner. Ektar por ekta. This is called cooperativity. So this is important term also. समझ में कुछ आ रहा है कि ऐसे ऐसे भेग है मत रहो कुछ नहीं होगा कुछ फर्क नहीं पड़ेगा मुझे खराब आज लगेगा लेकिन जब जाओगे बिहार ना तो मार खाओगे राइट तो कुछ सीख के जाओ पेशेंट के सामने तुमको कॉन्फिडेंस होना है इफ यू डोंट नो नॉलेज एट ऑल यू विल नॉट ट्रीट योर पेशेंट ओके सो कीप इन माइंड हमको पढ़ना है कि नहीं पढ़ना है तुम्हारा फेशियल एक्सप्रेशन इज नॉट राइट एट ऑल ये हम तुमको कह देते हैं ठीक है इसलिए मैं तुमको पिक किया Your facial expression should be like a medical school student. Sincerity, attitude, behavior, overalls. It's not like that. तो बिहार को सर छोड़ के आओ यहाँ पर आ जाओ पढ़ाई करो भाग जाओ पढ़ाई करना है तो ठीक से करो ढंग से करो ठीक है चलो so that is your concept of that's your polycythemia circulatory changes. So always remember the acclimatization happens in the ventilation level and the circulation level. In this way, if you think, then you can write at least if it is given as a 5 marks, you will pass. Whatever it may be. If you forget everything, but you remember that there is a 2 part is there. There is a ventilation part, one is circulation part. That keep in mind that yes, ventilation means your PaO2 when it is small a, which is P small a O2, that is partial pressure of O2 in arterial blood. If it is less than 60 millimeter of Hg, then the peripheral chemoreceptor will be stimulated and that will create a increased ventilations. But this ventilation does not help much, so the kidney will come to cover up, right? I am not into details into high altitude, right? So this is your total high altitude. Now the pulmonary diseases, already we explained different diseases of this one, but any pulmonary disease can cause a hypoxia. Hypoxic hypoxia. Basically, you have to remember that whenever this is a ventilation problem, diffusion problem, perfusion problem, then any disease, any one sector is cause your pulmonary disease, and that can cause a hypoxic hypoxia or hypoxemia. So if you get the short note of hypoxemia, always think about that is a hypoxic hypoxia. You have to write that, and this is the most important cause. This is the most important cause, and your treatment will be like that. You 100% oxygen. You will treat the 100% oxygen. But in case of shunting, what will happen? In case of shunting, that is also cause of hypoxia. Right to left shunt, right? Right to left shunt একটা নাম আছে Right to left shunt একটা নাম আছে Eisenmenger syndrome. Eisenmenger syndrome. I am not going details. Shunt does not mean always a cardiac. Shunting means interpulmonary as well as intercardiac. Whatever you are saying, that is a right to left shunt, that is intercardiac shunting. That also the pulmonary shunting also there. এই যে আগের দিন একজন ইয়ে করছিল, this is your, suppose this is your alveoli, right? Now, sorry, এটাকে ব্লু করে দিই, এটাকে এটাকে ব্লু করে দিই আর এটাকে রেড করে দিই, রাইট? এদিকে একটা গেছে, সরি, so what is happening here? Suppose আমি এখানে 50% শান্ট বলছি, 50% শান্ট মানে কি 50% ওদিকে যায় 50% এদিকে যায়। এইদিকে দেখ, there is a alveoli, not one, many alveoli are there practically, but suppose for your explanation part, so is the alveoli, there is no alveoli, right? Now এখানে যেহেতু ব্লাড যাচ্ছে, মনে করো এখান থেকে 50% অফ ব্লাড, এখানে 50% অফ ব্লাড এদিকে গেল, এদিকে গেল, 50% 50% ভাগ হয়ে গেছে, for your understanding. Now this 50% blood coming from the pulmonary vein, it came across with the friendship of these alveoli. That means it's getting the oxygen because ventilation is correct. Now ventilation is correct. Now ventilation is correct means so what? The PaO2 will change. First ventilation PaO2 was less and then is corrected, and then ultimately it will cause as a 95% of saturation. Suppose I am taking as a SpO2, right? Now this blood not getting at all any oxygenation from alveoli. There is no alveoli is there. There is no, there is no alveoli is there. If there is no alveoli, so there is no key, no diffusion. তাহলে সে কি করে পালমোনারি সেখান থেকে কে নিয়ে সাপোজ ইজ 70% of your you can, it's better to say not SpO2, PaO2, right? এটাকে PaO2 কর, পরে SpO2 করা যাবে, কারণ we are dealing in the blood, not in the your spirometry, your pulse oximetry. So PaO2 95% because of getting the oxygen, and here this is not getting oxygen 70%. Suppose this is mathematical, it will be less. You understand, this will be less, 70% মনে করে এখানে ছিল, মানে 70% means what? 70% of PaO2 এখানে ছিল, সেটা বেড়ে 95% হলো because of this alveoli, but not here. This is 70 to 70 রয়ে গেছে। এইগুলোকে অ্যাভারেজ করলে কত হচ্ছে বল? 95 plus 70 করলে অ্যাভারেজ কত হচ্ছে? 82.5% মানে PaO2, তাও লেস, মোটামুটি লেস, যদিও আমাদের এখন বলা হয় যে less than 80 is abnormal, is okay, no problem, but still this is less, not 100%, not 100%. We must be do as a 100%, আমার তো এখন 100% আছে, PaO2 basically is now 100%, so this is not 100%, so that is called shunting, that is called shunting, pulmonary shunting happening here, বোঝা যাচ্ছে? Now if you give the 100% oxygen, এবারে আমি 100% অক্সিজেন দিয়ে দিলাম, এতক্ষণ কি হচ্ছিল না 21% পাচ্ছিল, যা পাচ্ছিল, রাইট? এবারে আমি 100% অক্সিজেন দিয়ে দিলাম, 100% অক্সিজেন দিয়ে এ তো অনেকটা বেড়ে গেছে, এ নয় 98% হলো, বাট এখানে তো অক্সিজেন কিছু, এখানে তো 100% অক্সিজেন দিলে আমার কোথায় আসবে? এইখানে আসবে। So there is no relation of alveoli here. So do you expect the oxygen will be delivered here 100%? No, not at all. There is no connection. They are not meeting with any alveoli. So that's why that is 100% will not change as 70%, that will 70%, 60%, and ultimately it will cause only the 85%. তুই যদি হিসাব করে দেখিস দেখ এটা হয়তো একটু বাড়বে, not the 100%. So again, in case of shunting, there is a role of any oxygen. There is no role of any oxygen. So that's the point of interesting of shunting, is that intercardiac pulmonary also not helpful for oxygen by giving oxygen, and intercardiac also there is not helpful for your oxygen. ও যেটা বলছিল right to left shunt, I am coming. So in this fashion, this is shunting, is one of the important cause of hypoxia, right? So hypoxia causes দিলে এইভাবে তোরা বলবি, প্রথমে ওই তিনটাকে ভাগ করবি, রাইট? যেমন বললাম pulmonary disease, high altitude, and your ventilation, perfusion, coupling, alternation of VYQ by VVQ, you can say mismatch, that's causing, and also and also shunting. Shunting এর মধ্যে দুটো ভাগ করবি, intracardiac and interpulmonary. Interpulmonary মধ্যে এরকম একটা ছবি এঁকে দিতে পারিস, right? So that will be helpful for your examiner also. You are understanding properly as like your sign. What do you mean by shunting? So in this case, A B করে লিখলি যে এটা A B side there is no any connections of your alveoli. So whatever we are giving the 100%, 100% is coming in here, right? So that 100% means here P A capital O2 is increasing. If it is increasing, that will increase this one, right? Dissolved oxygen only gives the PaO2. Already in the previous class I mentioned, not the your connections of your hemoglobin, only the dissolved oxygen. That's why carbon monoxide is very important or very important gas for our diffusion capacity measurement, because that is never ever it come into the equilibrium, right? On continuously it's giving your CO and connections to your hemoglobin, but it's not coming into your dissolved form. So does not change any partial pressure of O2, and that's why it come into the equilibrium কখন হবে? যখন partial pressure of alveoli and partial pressure of your arterial blood will be same. Then you can get the equilibrium, right? So that this is a 100% oxygen দিলেও এই দিকে আমার কিছু চেঞ্জ হবে না, সামান্য একটু চেঞ্জ হবে, 85% does not matter at all. So that is less, right? In case of intracardiac also, first of all pressure changes happens into left to right. তোর জন্য বলছি left to right এ হবে, because left এ আছে 120 and then it come as a what is a 20-25 in case of right side. So pressure, high pressure to low pressure is coming, first এ কিন্তু এদিকে যাচ্ছে. So that will not so much problem, because oxygenated blood is coming into the some sorts of deoxygenated blood. But now when the day is going on, then the right ventricular chamber has to push the much more blood and causing the hypertrophy and causing the boost up for the major stroke volume. And then that shifting towards the right to left shunting, and that creates a problem, because if it is right to left shunt, that means deoxygenated blood is connected in oxygenated blood, and these oxygenated blood is pumping out throughout the body, right? And that causing the cyanosis, and we are getting the cyanosis whenever in child, any adult, anything else. That is your you can say right to left shunt means what? Tetralogy of Fallot's, transposition of great arteries, তারপরে TAPVC, I'm not going details about at all, truncus arteriosus, all the T's are here in the right to left shunting. যদি সব ভুলে যাস অন্তত মনে রাখবি, transposition of great vessels, tetralogy of Fallot's, tricuspid atresia, truncus arteriosus. So these are the diseases that is causing the right to left shunt. Another name is Eisenmenger syndrome, EI. Okay, so that is called Eisenmenger's syndrome. Just keep in mind, nobody will ask you in the physiology class, but it will see in your CVS in case of medicine. So this Eisenmenger syndrome happens due to your right to left shunt, and if it happens, then the 100% oxygen will not work in this similar fashion, right? Now, in case of hypoxic hypoxia, that means total hypoxia in the body is there. So vascular changes কি হবে? এই যে একটু আগে বলছিলাম যে আমার ventilation changes and circulatory changes. The circulatory changes এর মধ্যে that will come as a hypoxia induced vasodilatation of what? Vasodilatation of peripheral all arteries except pulmonary capillaries, because hypoxia causes vasoconstriction. বোঝা যাচ্ছে? So vasoconstriction করলে that will create a problem. Now a high altitude, মনে কর high altitude, if it is happens that vasodilatation happens, then cerebral vasodilatation also happens, তাই না? All the peripheral vasodilatation will happen. So cerebral vasodilatation will happen, high altitude. Then high altitude vasodilatation means what? Hydrostatic pressure will decrease or increase. আরে এত প্রেসার vasodilatation মানে বেশি করে ব্লাড যাচ্ছে তো, so that will increase hydrostatic pressure, it will increase. Very clear, এগুলো মাইন্ডগুলো একদম ক্লিয়ার রাখ. Whenever it is vasodilatation, the hydrostatic pressure is increasing, and if it is increasing, Starling force is increasing. So that is caused by your fluid deposition, fluid exudations into the cerebral tissue, and that's causing your cerebral edema, and that is called your HES. That is called your high altitude cerebral edema. বোঝা গেল? So that is called your high altitude cerebral edema. In this way, this is happening. So, প্রত্যেকটা জিনিসের আছে. Now, pulmonary edema also happens. That is called HEP, high altitude pulmonary edema. So, HES and HEP is a complications of your high altitude hypoxia. Right? HEP কেন হচ্ছে? High altitude pulmonary কেন হচ্ছে এটা? So, whenever vasoconstriction is there, vasoconstrictions also causing the hydrostatic pressure increase. ওখানে যেমন ভলিউমটা বাড়ার জন্য বাড়লো, এখানে জায়গাটা ছোট হওয়ার জন্য বাড়লো, and that creates the exudation of the fluid into the interstitial space and causing your pulmonary edema, and that is called your high altitude pulmonary edema, HES and HEP. It is a most important for your exam, short note, and also for your concept that high altitude sickness. That means what? In case of mountain sickness, it from acute mountain sickness to the HES. HESটা হচ্ছে extreme. HESটা হচ্ছে HES আর HEP হচ্ছে extreme লেভেলে। তার আগে আমার কি হবে না acute mountain sickness হবে। সেগুলো কি জিনিস? vomiting, abdominal pain, nausea, dizziness. This will happen. The acute mountain sickness is important. Chronic mountain sickness, the Mungi's disease. I will come. So that is a different thing. So these things your total hypoxic hypoxia. বোঝা গেল? আজকে যা hypoxic hypoxia পড়ানো হয়েছে পুরোটা কিন্তু important. Now second is your anemic hypoxia. It's very easy. Both rest is very easy. Anemic means what? Hemoglobin is less. So hemoglobin is which is less, there is no binding of oxygen at all, that causing the hypoxia. So if any anemic patient you are giving the 100% you giving the oxygen. Suppose in case of emergency, a patient has come with anemic 7 with the respiratory distress. You are thinking respiratory distress is there, you are giving oxygen. Do you think that will helpful? No, little bit that may helpful because there is an anemic, the hemoglobin is not. So treatment is RBC transfusion. So that's why the blood transfusion is indicated for that patients, so that respiratory distress will come on. I have seen lots of patients in children also. Only the blood transfusion causes the everything symptoms gone, right? So in this case, anemic. Now is it a stagnant? It's very important. If you think that blood flow, tissues, right? Myocardial infarctions. Second, tomar hypoxia. Cerebral tomar infarction, ischemia. That causing the on that local level hypoxia. That is called local level hypoxia. Yes, alveolar hemorrhage. No, alveolar hemorrhage basically কি করে না? কোথায়? Severe hemorrhage হলে আমার anemic hypoxia মানে বেশি হবে, not stagnant. If there is severe blood loss or hemorrhage, that means what? You hemoglobin lose. You are losing hemoglobin. That means what? You are anemic hypoxia. And stagnant or ischemic, stagnant means আমার দাঁড়িয়ে গেছে একটা blood vessel, cardiovascular system thrombus দাঁড়িয়ে গেছে সেখানে, so that is a pulmonary thrombus. That is also, it can cause also perfusion problem as well as it can cause the stagnant hypoxia. হ্যাঁ, শক তো সব সময়তে হতে পারে. Hypoxia may cause shock, hemorrhage may cause shock. Shock is a huge thing, right? I already explained everything. That is a different thing. Is stagnant means what? আটকে গেছে. Histotoxic means what? Histotoxic means what? Cyanide poisoning. Cyanide poisoning example is we can take. The tissue level oxygen is perfect, hemoglobin is perfect, right? Ventilation is perfect, PaO2 is perfect, PaO2 small a2 is perfect, but tissue level there is a problem. But why? Because the cyanide poisoning, in case of cyanide poisoning, you are seeing that the cyanide inhibits the cytochrome C enzymes. That is the mitochondrial enzymes, electron transport chain, right? And that may hamper the metabolism. And if it is metabolism problem is there, whatever it may be the O2, that will not helpful at all. So that is your histotoxic hypoxia. Very, very one of the important, very good. Why? Why? Why it happens? Yes, it has a important thing. I have seen one patient, actually as I remember, sit down, very good, and I am impressed by your saying that's a very, I never thought I will say that this in your first year classes. So, but Beriberi is a patient. I have seen only one patient Beriberi that has presented as a hypoxia due to this one, because these are electron transport chain inhibitions caused helpful. That is basically help করে ওটাকে, right? So if B1 is less, then that will be hampered and the histotoxic hypoxia happens, right? So whatever it may be, oxygen is very difficult to treat until unless you are giving the B1 substitution. The B1 substitution কিন্তু পাওয়া যায়. So thiamine injections is there, and we have applied and we treated that patients and quite fine. But regular injections is there because genetic problem is there, that baby was genetic problem to the enzyme. That enzyme means is protein, genetically is determined is there. So that is very is important cause of your histotoxic hypoxia. Very good. Thank you. আজকে এই পর্যন্তই থাক।